All right, so we're gonna try to open these up a little bit, lift the eyelids, make them less droopy, hopefully.
Okay, that sounds like a good plan.
Can we do that?
We can do that.
Okay.
But let me just review the day, then I'm going to review the procedure a little bit. So Mickey's going to go ahead and give you our cocktail, a little bit of Valium, just to relax you a little bit. You seem pretty relaxed though. Once we're ready, we'll head back. I'm going to go ahead and measure and mark, and we'll localize things. We'll numb things up like we talked about. You'll feel a little pinch, a little burn. You've experienced the same thing in the past with your hair anyway.
Right.
That's the worst part of the whole thing. Tracy's going to get you all wrapped up and draped, we call it. Probably wait about 10 minutes or so, and then we'll come back and get started.
Okay.
The lights are off in the room. I wear a bright headlight, so the eye that we're not working on we'll cover with a wet gauze. You'll be talking, you'll be relaxed. If you fall asleep, we'll let you fall asleep. If you want to converse, that's fine. But let's talk specifically about what we're doing. So the tissue that we're addressing here is this stuff here.
Right.
Okay. So we're not changing the position of your eyebrow. We're going to open up your eyelid. So the result will be something without raising your brow. We're going to try to give you do have an eyelid under there, okay? So we're going to get rid of some of this tissue. We'll be able to see your eyelid. You and I have talked a number of times before anyway. Some of the differences between men and women are that we're going to take those measurements that we talked about. I'm going to be a little bit more conservative.
Right.
Okay, we don't want to sculpt your eyelid. Kenny Rogers seems to be the male model for what not to do, and that's not what our plan is. So we'll excise the right amount of skin, and we'll do our job. So you'll look more refreshed. That's the goal.
Excellent.
Got it?
All right.
That's the plan. So we will get underway here. Mickey's got your drugs coming.
Your instructions are to relax and rest the rest of the day. Don't do anything that's going to elevate your blood pressure.
Okay.
Sleep elevated a little, a couple of extra pillows. If you do you have a recliner at home?
I do not have a recliner, but I got some extra pillows.
Yeah. So just prop yourself up. We want your head above your heart to reduce swelling.
Okay.
The cold will constrict your blood vessels to help prevent, hopefully, more bruising than you want. And then take your Medrol dose pack as instructed. If you have any pain, the most I think you're going to feel is a little burning in the incision, so extra strength Tylenol. If that doesn't help with food on your stomach, you could take a half to one of the Vicodin that we gave you, the Norco. Okay? But other than that, most patients don't have to take anything other than Tylenol.
Okay.
And there's a water for you. A 0-calorie cocktail, we call that. We like those.